Common serious health issues in elderly people aged 70 to 100. 1. Cardiovascular disease remains the leading cause of death in the elderly, despite a decrease in mortality rates over the past 2 decades. This group of diseases includes conditions such as chronic ischemic heart disease, congestive heart failure, and cardiac arrhythmias. The natural aging process involves vascular remodeling and increased arterial stiffness. Atherosclerosis, which causes inflammation and other changes in blood vessels, significantly increases the risk of cardiovascular events, strokes, peripheral vascular disease, cognitive decline, and damage to other organs. Hypertension, a major factor contributing to the development of atherosclerosis, is the most common chronic disease in the elderly. Isolated systolic hypertension is especially common in this age group and is associated with an increased risk of mortality even in very old age. 2. Cancer is the second leading cause of death in the elderly. However, it's worth noting that cancer mortality rates tend to decrease after age 85. Studies show that slow-growing tumors seem to be more common in this population. Patient response to cancer treatments often depends more on their overall functional status than on their age. Therefore, denying aggressive treatment to very elderly individuals based solely on age is not justified. 3. Osteoarthritis is the second most common chronic condition in the elderly in the United States and is a frequent cause of chronic pain and disability. The incidence of osteoarthritis appears to be higher in women than in men. Obesity is identified as a significant risk factor for osteoarthritis, and as the population ages, especially with the rising rate of overweight individuals, the prevalence of severe hip and knee arthritis is expected to continue increasing. Managing pain from osteoarthritis in the elderly poses many challenges due to the potential risks associated with using pain medication in this age group. 4. Infections, particularly respiratory infections like pneumonia and urinary tract infections, UTIs, are common causes of sepsis in the elderly. Sepsis is a serious medical emergency that can rapidly progress to severe sepsis, which is especially dangerous for the elderly. Adults over 65 are 13 times more likely to be hospitalized for sepsis than younger adults. It's important to note that signs of infection in the elderly may be atypical. For example, a change in mental status, such as confusion or disorientation, may be the first sign of a UTI in many elderly individuals. 5. Alzheimer's and other forms of dementia are not an inevitable part of aging. However, the incidence of these diseases increases significantly with age, severely affecting memory, cognitive abilities, and the ability to perform daily living activities. Alzheimer's is the most common cause of dementia. Early warning signs can include memory loss that disrupts daily life, difficulty planning or solving problems, trouble completing familiar tasks, confusion with time or place, difficulty with language, frequent misplacement of objects and inability to retrace steps, decreased judgment, withdrawal from social activities, and changes in mood or personality. 6. Osteoporosis is a common health condition in the elderly, especially in postmenopausal women and men over 70. This disease reduces bone density, making bones brittle and more prone to fractures. Osteoporosis often progresses silently and without obvious symptoms until a fracture occurs, usually due to a fall. 7. Vision and hearing problems are also very common in the elderly. Diseases such as cataracts, glaucoma, and macular degeneration can cause severe vision loss, greatly affecting quality of life. Age-related hearing loss, presbycusis, affects about half of all people over 85 and can lead to social isolation, depression, and cognitive decline. 8. Additionally, the elderly may experience many other health problems such as anemia or iron deficiency, chronic kidney disease, chronic obstructive pulmonary disease, COPD, digestive and liver issues, dental problems, sleep disorders, urinary and bowel incontinence, dizziness and balance problems, malnutrition, and eating disorders. Geriatric syndromes such as frailty, incontinence, falls, delirium, and pressure ulcers are also common.
Another worrying risk is the high rate of hospital readmissions after serious illnesses, especially sepsis. 9. Researching preventive measures. Preventing cardiovascular disease in the elderly requires a combination of factors, with healthy lifestyle habits playing a crucial role. A diet should focus on increasing consumption of fruits, vegetables, whole grains, fish, especially fatty fish rich in omega-3 fatty acids, nuts, and legumes. Low-fat dairy products and skinless poultry should be prioritized, while limiting sugary drinks, red meats, and processed foods. Adopting a Mediterranean or DASH diet also provides proven benefits. Regular physical activity is an indispensable factor. The elderly should aim for at least 150 minutes of moderate intensity or 75 minutes of high-intensity physical activity per week, or a combination of both. In addition, incorporating muscle-strengthening exercises at least 2 days a week is also important. Research shows that walking an additional 500 steps per day is associated with a reduced risk of cardiovascular disease, stroke, or heart failure in people over 70. Quitting smoking is one of the most important actions to protect cardiovascular health, as it is the leading preventable risk factor for heart disease and stroke. Limiting alcohol consumption is also crucial, as excessive alcohol intake can lead to serious heart and blood vessel problems. In addition, managing stress through relaxation and effective coping methods, ensuring sufficient sleep, 7 to 8 hours per night, and maintaining healthy blood pressure and cholesterol levels are key factors for preventing cardiovascular disease in the elderly. Daily aspirin use for primary prevention of cardiovascular disease in people over 60 may carry a higher risk of bleeding than benefits and is generally not recommended. Any decision to use aspirin should be thoroughly discussed with a doctor to assess individual benefits and risks. Preventing cancer in the elderly involves both regular screening to detect the disease early and adopting a healthy lifestyle to reduce the risk of developing the disease. Cancer screening recommendations may vary depending on age, gender, personal and family medical history, and other risk factors. For example, for breast cancer, women aged 55 and older should have mammograms every 2 years, or may continue annual screening if their health allows and their life expectancy is long. However, breast cancer screening is generally not recommended after age 75 due to a lack of clear evidence of benefit. Similarly, colorectal cancer screening should begin at age 45 and continue until age 75 through stool tests or colonoscopy. For those aged 76 to 85, the decision to continue screening should be made after discussion with the doctor, considering personal preferences, overall health, and previous screening history. Generally, colorectal cancer screening is no longer recommended for people over 85. Annual lung cancer screening with low-dose CT, LDCT, is recommended for people aged 50 to 80 with a history of heavy smoking, at least 20 pack years, and who currently smoke or have quit within the past 15 years. Men aged 50 and older should discuss the benefits and risks of PSA testing with their doctor to decide whether to screen for prostate cancer. For cervical cancer, screening should begin at age 25 and continue until age 65. It is important that the elderly discuss with their doctor about a cancer screening schedule that suits their health status and personal risk factors. In addition to screening, maintaining a healthy lifestyle plays a key role in cancer prevention. This includes not using tobacco in any form, protecting the skin from sun damage by using sunscreen regularly, following a predominantly plant-based diet rich in vegetables and fruits, limiting alcohol consumption, maintaining a healthy weight and regular physical activity, and practicing safe sex to reduce the risk of HPV infection. A recent study found that daily supplementation with vitamin D and omega-3 combined with a home exercise program can significantly reduce the risk of invasive cancer in people over 70. To prevent diabetes in the elderly, maintaining a healthy weight is crucial. Weight loss, even a small amount, has been shown to significantly reduce the risk of developing type 2 diabetes. In addition, following a healthy diet plays a key role. The diet should focus on increasing consumption of vegetables, whole grains, and lean protein, while reducing fat and red meat intake. Regular diabetes screening is also important, especially for those with risk factors such as overweight, obesity, or a family history of diabetes. Medicare provides a free annual wellness visit, including a diabetes risk assessment. Regular physical activity is also an integral part of diabetes prevention. The elderly should aim for at least 2.5 hours of exercise each week. Even gentle activities like brisk walking provide significant benefits. In some cases, doctors may recommend using metformin for people with prediabetes to help prevent progression to type 2 diabetes. Another important aspect to note is that the elderly are at higher risk of hypoglycemia, so tight blood sugar control may not be appropriate in people with multiple comorbidities or functional decline. Studies show that lifestyle changes can slow the progression from prediabetes to diabetes. Therefore, encouraging the elderly to participate in lifestyle-based diabetes prevention programs is very important. 10. Cognitive decline and maintaining brain function. Early signs of cognitive decline in the elderly can vary widely and often include forgetfulness, especially of recent events. Sufferers may miss appointments or social events, lose concentration, or have difficulty following the plot of a book or movie. They may have trouble finding the right words to express themselves or experience language problems in general, as well as difficulty planning or solving daily problems. Spatial orientation can also be affected, making it difficult for the person to find their way around familiar places. Judgment can decline, and these changes are often noticeable to family and friends. Other signs include asking the same question repeatedly, forgetting recent events or conversations, difficulty completing familiar tasks at home, work, or leisure, confusion with time or place, difficulty understanding visual images and spatial relationships, frequent misplacement of objects in unusual places and inability to retrace steps, withdrawal from social activities, and changes in mood or personality. It's important to distinguish between normal age-related memory changes and true signs of cognitive decline. Changes that affect the ability to perform daily living activities and complete familiar tasks are more concerning signs. To maintain brain function in the elderly, engaging in regular intellectual activities is crucial. This can include solving puzzles, playing brain games, reading books, and learning new skills or a new language. Research has shown that learning a new skill can significantly improve memory in the elderly. Maintaining social activity also plays a key role. Connecting and interacting with family, friends, and the community, participating in clubs, organizations, or volunteer activities can help stimulate the brain and reduce the risk of cognitive decline. Studies have shown that social isolation is associated with a higher risk of cognitive decline. Regular exercise also provides many benefits for brain function. Physical activity helps increase blood flow to the brain and is associated with improved cognitive abilities, including memory and concentration, and reduced risk of dementia. A healthy diet also plays an important role. Following a balanced diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats, especially omega-3 fatty acids, can help maintain brain health. Diets like the Mediterranean and DASH have been shown to be associated with slowing cognitive decline. Getting enough sleep, usually 7 to 9 hours per night, is also important for brain function. In addition, managing stress through stress reduction techniques such as mindfulness and meditation can also provide benefits. Good management of chronic health conditions such as high blood pressure, diabetes, and high cholesterol can also help reduce the risk of cognitive decline. Finally, avoiding smoking and limiting alcohol are also important, as both can harm brain function. 11. Maintaining mental health and reducing the risk of depression and loneliness. To maintain mental health in the elderly, maintaining social connections is crucial. This includes staying in regular contact with family, friends, and engaging in social activities. When face-to-face meetings are not possible, using technology to connect, such as phone calls or video chats, can be very helpful. Engaging in meaningful activities also plays an important role in maintaining mental health. The elderly should seek activities that bring joy and purpose, such as pursuing hobbies, participating in volunteer activities, or learning something new. If feeling sad, anxious, or lonely, don't hesitate to seek support from relatives, friends, or mental health professionals. Practicing mindfulness through relaxation activities such as meditation, yoga, or breathing exercises can also help reduce stress and anxiety, thereby improving mental health. Getting enough sleep is also important for maintaining good mood and overall health. Finally, maintaining a stable daily routine can provide a sense of comfort and security, contributing to better mental health. To reduce the risk of depression and loneliness in the elderly, maintaining regular contact with family and friends is crucial. This can be done through phone calls, letters, emails, or face-to-face meetings. Joining clubs, community centers, or other social activities can also help the elderly connect with people who share their interests and reduce feelings of loneliness. Volunteering is a great way to feel purposeful and connected to the community. If you have difficulty coping with negative emotions, don't hesitate to seek professional help from a doctor or mental health professional. Even caring for a pet can provide companionship and reduce feelings of loneliness. Remember that loneliness and social isolation can be as harmful to health as smoking or excessive alcohol consumption. Therefore, proactively creating opportunities for social connection for the elderly is extremely important. 12. Preventing falls and common accidents. Preventing falls at home is a key factor in maintaining independence and preventing serious injuries in the elderly. Most falls occur at home, so taking simple steps to make the living environment safer can significantly reduce this risk. Measures include removing obstacles on floors, stairs, and walkways, such as unsecured small rugs, electrical cords, and excess items. Ensuring adequate lighting in the house, especially on stairs and walkways at night, and using nightlights can help the elderly move around more safely. Installing handrails on both sides of stairs and grab bars in the bathroom, near the toilet and shower, is also important for balance support. Non-slip mats should be used in the bathroom and kitchen to reduce the risk of slipping on wet surfaces. Choosing the right footwear is also crucial. The elderly should wear shoes with non-slip soles, a good fit, and avoid wearing slippers or going barefoot on slippery floors. Regular vision and hearing checks can help detect problems that may increase the risk of falls early. The elderly should also consider the side effects of their medications, as some medications can cause dizziness or drowsiness, increasing the risk of falls. When standing up, do so slowly to avoid dizziness from sudden postural changes. If feeling unsteady when walking, using mobility aids such as canes or walkers can help increase stability. Finally, regular exercise to improve muscle strength and balance is also an effective fall prevention measure. In addition to falls, the elderly are also at high risk of other accidents. To ensure safety when driving, the elderly should drive in good weather conditions, avoid driving when tired or taking medications that may cause drowsiness, and have regular eye exams. If you feel unsafe driving, consider stopping driving. For fire prevention, install smoke detectors and check them regularly, do not smoke in bed, and have an emergency escape plan. To prevent poisoning, the elderly should read and follow instructions for using medications and chemicals carefully, store them in a safe place, and check the expiration date of food before using.